They won't tell you this at your regular doctor's visit, but let's be honest, if you've stopped masturbating in old age, it's possible your body is already deteriorating, and you probably don't even know it. No, this isn't a taboo subject or some locker room nonsense. It's a real, clinical, and physiological truth, and the consequences of ignoring this truth can be devastating, not just for your sexual health, but for your brain, your heart, your sleep, your immune system, and even your self-esteem. My name is Dr. David Carter. I am a urologist and men's health specialist with over 30 years of experience working with older patients across the country. I've dedicated my career to studying the changes our bodies go through as we age, especially when it comes to intimacy, hormones, and long-term vitality. And one of the biggest silent threats I've seen is this: too many older Americans abandon their sexual health, and with it, a key aspect of their overall well-being. Here's what might surprise you: masturbation isn't just a leftover impulse from your youth. In fact, it's one of the most powerful tools your aging body still has to regulate your hormones, strengthen your brain, protect your prostate, and even fight depression. And if you've stopped masturbating, or never started, the price you're paying could be much higher than you think. In the next few moments, I'll explain exactly what happens in your body when you stop masturbating in old age, and what I share could completely change your perspective on your health and on yourself from now on. Before we begin, if you care about staying sharp, healthy, and independent as you age, subscribe and hit the notification bell so you don't miss important advice designed especially for you. And if this message resonates with you, type a 1 in the comments. If not, type a 0. Your feedback helps me create content that truly supports your health and well-being. Now, let's start with the first, and perhaps most overlooked, consequence of not masturbating in old age: the silent effect it has on the health of your prostate and urinary tract. 1. Decline in prostate health and urinary function. When I started practicing urology over 3 decades ago, I didn't expect so many of my patients to open up about something so private yet so crucial to their health: the quiet disappearance of sexual habits in old age. One man, I remember him clearly, sat across from me and said, "Doc, I thought I didn't need that part of my life anymore." He was in his early 70s, from a small town in Ohio, fit and alert, but he was waking up 4 or 5 times a night just to use the bathroom and couldn't understand why. What he didn't know, and what most men don't realize, is that regular ejaculation, even through masturbation, plays a crucial role in the proper functioning of the prostate. The prostate isn't just a passive gland, it's a living, dynamic organ. It produces fluid, expands, and contracts, and like any system, it suffers if neglected. Without regular stimulation and release, prostatic fluid can stagnate. This stagnation creates the perfect environment for inflammation, swelling, and, over time, pressure that disrupts everything from urination to sexual performance. You might feel it as a heavier bladder, a weaker stream, or an uncomfortable sense of fullness that doesn't go away. These aren't just annoyances, they are early warning signs. And here's where it gets dangerous: chronic prostate congestion can discreetly worsen into more serious conditions like benign prostatic hyperplasia, BPH, which affects nearly 50% of American men over 60. If left unchecked, it can lead to urinary retention, bladder infections, and even the need for a catheter. The same man I mentioned eventually needed surgery to relieve the pressure, something that, if addressed earlier with simple, consistent habits, might have been avoided. Regular ejaculation helps to clean out the prostate, flush the urinary tract, and reduce the risk of buildup. In fact, studies from leading U.S. medical institutions have shown that men who ejaculate 21 or more times a month have a significantly lower chance of developing prostate cancer. And let me be very clear, we are not talking about returning to your youth or any kind of obsessive behavior. This isn't about fantasy, it's about function, using your biology to protect your body in the simplest, most natural way possible. By stopping masturbation in old age, you're not just ignoring pleasure, you're risking pain, inflammation, and a gradual loss of control over one of the most basic human functions: urination. I've had patients who became afraid to leave the house because they couldn't trust their bladder. I've seen strong, proud men reduced to sleepless nights and daytime anxiety over a condition that could have been managed or prevented with something as simple as regular self-stimulation. And yes, there's a mental toll, too. Losing control of your body in this way, having to plan your life around bathroom stops, fearing long car rides, waking up every 2 hours at night, it undermines your sense of independence. It's not just about your prostate, it's about your freedom. But here's where it gets even more surprising. Because what starts in the prostate doesn't stay there. The next consequence affects not just the body, but the brain, and once it begins, it can alter how you think, feel, and remember, sometimes in ways that are difficult to reverse. Let's talk about what happens to your mental clarity and cognition when self-stimulation disappears from your routine. If you're still here and these reflections are feeling familiar, type the number 1 in the comments. It lets me know you're still with me, still engaged, and still valuing this message. Now, let's continue with point number 2. 2. Cognitive fog and a decline in mental clarity. Not long ago, a patient in his late 60s came to see me. He wasn't complaining about his prostate or his energy. He just said something that struck me, "Doctor, I just don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my train of thought mid-sentence. I used to be so sharp. Is this just old age?" It's a question I hear more often than you'd think. And yes, aging naturally brings some cognitive changes. But what most people, even highly educated, health-conscious adults, don't realize is that sexual activity, including masturbation, plays a fundamental role in protecting brain function. Here's what happens. When you engage in self-pleasure, your brain releases a cocktail of neurochemicals, dopamine, serotonin, oxytocin, all of which are directly linked to memory, focus, and emotional regulation. These chemicals don't just feel good, they help build and protect neural connections. They stimulate blood flow to the brain and reduce cortisol, the stress hormone that, in high amounts, is damaging to neurons. Now, when you stop masturbating, especially for a prolonged period, those natural, brain-protecting chemical flushes become less frequent. Over time, this can weaken your mental capacity. You might find it harder to concentrate, process information, or even feel motivated. It doesn't happen overnight. It creeps in slowly. First, you forget names. Then, you forget what day it is. Then, you start to doubt your mind altogether. And in that doubt, something worse can take root, fear. I've seen patients spiral into anxiety and depression simply because they believed they were losing it, when in reality, their brain was lacking stimulation and chemical balance. In men, there's an additional hormonal shift. Testosterone, the hormone intimately tied to memory, decision-making, and vitality, can decline more rapidly when sexual activity drops to near zero. Testosterone doesn't just affect libido, it affects your self-confidence, your strength, and your clarity. And yes, frequent, healthy ejaculation can help regulate and preserve testosterone levels as we age. Some studies have even begun to link reduced sexual activity in older adults with the early signs of cognitive decline, even dementia. Now, I'm not saying that stopping masturbation causes Alzheimer's. But what I am saying is this: when the brain is deprived of stimulation, emotional release, and hormonal support, it becomes more vulnerable. It loses its rhythm, its resilience. One man told me he stopped going to his weekly poker night with his buddies because he could no longer focus on the game. Another, a retired professor from a New England college, said he felt hollow every morning. These weren't memory issues that required medication, they were symptoms of a life disconnected from physical intimacy, even with oneself. And here's the tragic part: these are preventable. You don't need pills or expensive therapies. Sometimes, it starts by reconnecting with your body. Because when you stimulate the body, you awaken the brain. But this loss of mental sharpness is only part of the equation. What happens next, when the emotional balance starts to erode? Let's explore how giving up on intimacy can quietly invite depression into your daily life. 3. Heightened depression and emotional numbness. I once had a patient in his 70s, widowed, retired from a long career in manufacturing, relatively healthy, who came to me not for a physical ailment, but for something he couldn't explain. He looked me in the eye and said, "I don't feel anything anymore. Not sadness, not joy, just emptiness." He paused, then added, "Is that normal for someone my age?" That question still resonates with me because I hear variations of it constantly. What many people assume is just part of aging, the boredom, the disconnection, the slow fading of emotions, often has a deeper, physiological cause, the loss of sexual stimulation. Here's the truth: when you stop connecting with your own body in an intimate, physical way, your emotional landscape can begin to change silently but profoundly. Masturbation isn't just a physical act, it's an emotional release. It's your body's built-in system for stress relief. During climax, the brain releases powerful chemicals like oxytocin and endorphins, which are natural mood stabilizers that combat anxiety and low spirits. When you remove that release from your life, especially at a time when stress, loneliness, or grief may already be present, you risk becoming emotionally numb. And that numbness can drift into something more dangerous: depression. I've seen it unfold slowly. Someone stops masturbating after losing a spouse or because they believe it's no longer age-appropriate. The weeks turn into months. They become quieter, more withdrawn. They lose interest in their hobbies, like fishing or gardening. Life starts to feel gray. And the cruel irony? Most don't realize the connection. They blame themselves, their age, or think, this is just how life is now. But in reality, what's missing is the simple act of connecting with their own body, not just for pleasure, but for emotional survival. Depression in older adults is often underdiagnosed because it doesn't always show up as sadness. Sometimes, it manifests as fatigue, irritability, detachment, or a don't-care attitude. And while medication and therapy are important tools, I can't tell you how many patients I've helped simply by encouraging them to reclaim physical intimacy. One man told me he felt alive again after he started touching himself regularly for the first time in years. He said it didn't just improve his mood, it reminded him that he was still a human being, not just a body winding down. That small act gave him back a part of himself he thought was lost forever. This is what I want you to understand: masturbation in old age isn't about shame. It's about keeping your emotional system healthy. Because when you lose that connection, you don't just risk sadness, you risk isolation and a loss of the will to live. As the nights get longer and sleep becomes more elusive, another hidden cost emerges. Let's now talk about how a lack of sexual pleasure could be robbing you of the deep, restorative sleep your body desperately needs. If you're still watching and finding these insights meaningful, type a 1 in the comments. Now, let's move on to point number 4. 4. Poor sleep quality. I remember a woman in her late 70s who came to me after months of poor sleep. She looked exhausted, pale, and frustrated. "Doctor," she said, "I fall asleep, but I wake up at 2 a.m. like a shot. Then I just lie there, staring at the ceiling, waiting for the sun to come up." We ran tests. Her labs were clean. No sleep apnea, no major red flags. But when I gently asked about her intimate life, she looked away. "That part of me," she muttered, "is over." But that part of her, the part she thought was expired, was possibly the key to what her body was craving: deep, restorative sleep. Sleeping isn't just about closing your eyes. It's a complex hormonal process, and one of the most effective natural triggers for deep sleep is the orgasm. During climax, the body releases oxytocin, prolactin, and endorphins, a perfect chemical combination to shift the nervous system from stress to rest. At the same time, cortisol, the hormone responsible for anxiety and wakefulness, plummets. Imagine removing that process from your life. That's what happens when older adults stop masturbating. The body loses a natural tool it once depended on. Some turn to sleeping pills, others simply accept exhaustion as the new normal. But the consequences of poor sleep go far beyond just feeling tired. Chronic sleep deprivation weakens the immune system, accelerates cognitive decline, and increases the risk of heart disease. In older adults, it also contributes to falls and a loss of independence. Masturbation might seem like a small act, but for some, it can be the difference between 4 hours of fragmented sleep and 7 hours of deep rest. One patient told me after reconnecting with this part of himself, "I'm sleeping like I did 30 years ago." I didn't realize how much I needed that release. I just thought I was getting old. Too many people confuse biological neglect with aging. If you find yourself lying awake at night, ask yourself, when was the last time your body felt completely released? Sometimes the answer isn't a new medication or a breathing app. It's about rediscovering an old rhythm. Next, let's talk about what really happens to your pelvic floor and circulation when intimacy disappears. 5. Weakened pelvic floor and blood circulation. Several years ago, I treated a retired firefighter from Chicago, a man who had been proud and physically strong for his entire life. He came to me complaining of mild urine leakage and discomfort in his lower back. "It's strange," he said, "I feel like the foundation of my body is slowly weakening." What he was describing wasn't just aging, it was the slow weakening of his pelvic floor, the group of muscles at the base of your torso that support your bladder, bowels, and sexual organs. Regular sexual stimulation, including masturbation, plays a critical role in keeping those muscles active. During arousal and orgasm, the pelvic floor contracts rhythmically. That contraction is an exercise for functionality. It enhances blood flow to the lower body and strengthens your internal support system. When you stop masturbating, those muscles begin to atrophy. Blood flow decreases, tissue loses elasticity, and you might find yourself dealing with unexpected symptoms, a frequent urge to urinate, slight dribbling, or erectile dysfunction. I've seen once-independent adults start to avoid social outings because they don't trust their bladder. They become embarrassed by sudden leakage when they cough or sneeze, not knowing it all traces back to a lack of circulation and muscle activity in their pelvic region. Ignoring this area can lead to falls, incontinence, and a loss of dignity. You might start relying on pads or planning your life around the nearest restroom, all because the foundation of your body isn't getting the stimulation it needs. What breaks my heart is how many people suffer in silence. They feel ashamed or assume it's just part of getting older. But your body still wants to function, even at 70 or 80. One of the most natural ways to support it is through safe, regular, intimate stimulation. But as physical as this is, the next consequence is even more profound. It affects your immune system and your body's ability to protect you from disease. 6. A weakened immune system. A few winters ago, one of my regular patients, a man in his late 70s from Minnesota, came in looking drained. He had been sick 3 times that season with lingering colds. He told me, "I used to bounce back in a day or 2. Now, any little bug knocks me out for weeks." When we ruled out the usual suspects, I gently asked about his sexual activity. He gave a self-conscious smile and shook his head. "Not in a long time. That part of me is just retired." What he didn't understand is that sexual activity has a direct impact on the immune system. During orgasm, the body produces a surge of immune-boosting agents like immunoglobulin A key antibody that helps defend against viruses and bacteria. Imagine living without that boost for years. Your body loses one of its most natural defenses when its immune system is already slowing down. It's like taking the batteries out of your smoke detector. I've seen this in real time. Patients who shut down their intimate lives often get sick more frequently and recover more slowly. Their body is sending a clear signal, something is missing. And it's not just about fighting off the flu. A strong immune system is linked to long-term disease prevention. One woman in her 70s, after losing her husband, reconnected with this part of herself, not for desire, but for well-being. Months later, she returned with more energy. "I can't explain it," she said, "but I feel more alive. It's like my body is working with me again, not against me." But while low immunity can expose your body to illness, the final consequence could undermine your sense of self even more deeply. 7. Loss of body ownership and self-esteem. I'll never forget a quiet conversation with a patient in his late 70s. He was a retired high school principal from Texas, formerly self-assured and witty. But when he came in, something in his posture had changed. He sighed and said, "I don't feel like I live in this body anymore. I feel like I'm just inhabiting it." What he described is not uncommon. Far too often, it starts with giving up on intimacy. When you stop touching your body in that deeply personal way, you start to disconnect from it. Self-touch isn't just about pleasure, it's about presence. It reminds your nervous system that you are still here, that you matter. Without that, a psychological distance is created. It becomes easier to ignore aches and pains, to stop looking in the mirror, and to believe this stage of life isn't worth engaging with. That is the most dangerous loss of all, the loss of your own sense of worth. One woman told me she hadn't touched herself since menopause. "I just stopped feeling like a woman," she said. The less she touched herself, the more that identity disappeared. It's a gut punch, because that is precisely what happens to so many older adults. They don't just lose pleasure, they lose vitality. It doesn't have to be this way. Reclaiming your body through self-touch isn't about being sexual the way you were at 20. It's about honoring the life that is still in you. It's about saying, "I am still here. I am still feeling. I am still worthy of being seen, even by myself." When you reconnect with your body, you start to reverse that silent disappearance. You come home to yourself. And that, perhaps, is the most healing act of all. Final reflections: reclaiming intimacy, reclaiming health. As I look back on the years I've spent caring for older patients, what strikes me most are the silent, invisible losses they carry. A man who once felt confident now avoids mirrors. A woman who once radiated joy now feels nothing. And most of the time, they've been told, this is just what aging looks like. But I don't believe that for a second. The moment you abandon your sexuality, a chain of silent consequences begins: a deteriorating prostate, a foggy brain, depression, poor sleep, a weakened immune system, and a loss of self-esteem. These are not just part of getting older. They are warning signs. I have known patients who felt broken and have seen the transformation when they reclaim this part of their lives. It doesn't require a partner. It just requires your permission to see yourself as worthy of intimacy. Especially now. I know this is a topic many people avoid. But I want you to hear this from a doctor who has walked this path with thousands of Americans. It is not just okay, it is essential. Masturbation in older adulthood isn't just about pleasure. It is a form of self-care, a declaration that you are still alive in this body. One patient once told me, "I didn't realize how much I missed feeling like myself until I finally reconnected with that part of me." That's what this is about. Not just surviving the years, but inhabiting them with presence and dignity. So, if you have forgotten this part of yourself, I invite you to reconsider. To reconnect. Start small, with kindness. But most importantly, start. Because by choosing to care for this part of you again, you are not just protecting your health, you are reclaiming your life. If this message resonated with you, don't keep it to yourself. Like this video, share it with someone who might need to hear it, and leave a comment below to let me know your thoughts. Your voice matters, and your story might just help someone else feel seen.